All right, today I'll be talking about the heart itself, or the heart as a muscle pump. Now, first, before I talk about the heart, I need to identify that this is the apex of the heart. It's being formed mainly by the left ventricle, and this is basically the base of the heart, which is being basically formed by different blood vessels. And whenever I say the word blood vessels, they indicate we have arteries and veins. All right, so let's take the scope from the outside portion right here. Now we have a venous return coming out from the head and neck, upper limbs, and the thorax is draining, or blood draining, into the superior vena cava, into the right atrium. And the other portion right here, this is called the right auricle. Now this portion of the heart is called the right ventricle. And we have something called the coenus arteriosus. And on the left side, we would have the left auricle that's covering up the left atrium, and again we have the left ventricles right there. Now we have something called the pulmonary trunk, subdivided into left pulmonary artery and a right pulmonary artery. Please keep in mind that these arteries carry deoxygenated blood. That means it's low levels of oxygen. So they're going to the lungs in order to get some oxygen. All right, now this is just the connection between the pulmonary trunk and the aortic arch, or the arch of the aorta, that closes right after the delivery, and it's called ligamentum arteriosum. If this is still patent, it's called the patent ductus arteriosus. So it will just connect between the venous blood system and the arterial systemic circulation. All right, so let's go ahead and talk about different structures as we go. Now, this is the aortic arch, or the arch of the aorta. This is the ascending, it's going up, called ascending aorta, aortic arch. Then we have the descending thoracic aorta. And by having the descending thoracic aorta, we have multiple branches that's giving off towards the mediastinum, the esophagus, the trachea as well, and along as we go. All right, so let's go ahead and take this vascular system out. All right, and underneath we have the pulmonary. See over here, this is the pulmonary trunk. Then we would have the pulmonic, or the pulmonary valve right there. So it's called the pulmonic valve. Next to it, we have the aortic valve right there. Please keep in mind there are tricuspids. That means they would have 3 different cusps, or valves, yes. So whenever we see over here, this is the right coronary artery. This is the left coronary artery. And the branch coming off from the left coronary artery, the anterior interventricular artery. And we would have a different branch coming off. So this is called the circumflex artery. Along within the artery, we have a vein. It's called the great cardiac vein. And we would have the small cardiac vein draining the venous, cardiac muscles itself. Now back to the artery, towards the right coronary artery, we have a branch coming off. It's called the marginal artery right there. Okay. Now if I'm gonna flip this, just to continue the circulation right there, now we have the middle cardiac vein coming along with the small cardiac vein, and there eventually will drain into the coronary sinus, and eventually this would open up within the right atrium. Now, what is this vessel? It's coming off, or draining off the venous return from the lower limb, anything that's below the diaphragm muscle. So we have the lower limbs, pelvis, abdomen, so they will collect into something called the inferior vena cava. And again, the inferior vena cava come along with the superior vena cava, and they will drain into the right atrium right there. So this is the right atrium, this is the left atrium, and this is the interatrial septum. So it's the interatrial septum. This is the right ventricle, this is the left ventricle, and this is the interventricular septum. And this is the papillary muscles, and this is the anterior papillary muscle. And look at this thickness over here of the left ventricle compared to the thickness of the heart, or the cardiac muscle right there. So the left is a lot thicker and bulkier than the right. Now this is the left ventricular outflow tract coming off. And if you look over here, now number 6, right there, this was an opening that got closed or shut down. It's called the fossa ovalis. And this is the opening of the coronary sinus that's draining off the venous return coming up from the cardiac or the heart veins. All right, so let me go ahead and talk about the different pulmonary veins. So we have 4 different pulmonary veins. They're coming back from both lungs. So this is 1, 2, 3. And if I'll just place this portion up here, then that's the 4th one right there. So we have a right and a left superior and a right and a left inferior pulmonary veins. And please keep in mind that this is the exception to the rule. The 4 pulmonary veins will carry oxygenated blood that's going back into the left atrium. Okay, so let's go ahead and talk about the different valves that we have. Now those are the valves right there. Now this is the actual valve, and those are the chordae tendini or the chordae tendini. Basically the valve is located right here. This is the valve itself. It's a cut section of a valve, and the chordae tendini or the chordae tendini will be attached to onto the papillary muscles. Keep in mind that the chordae tendini and the papillary muscles are located only within the ventricles, both ventricles. Now the valve that's present between the right atrium and the right ventricle is called the tricuspid valve. And the valve that's present between the left atrium and, let's pretend that this is right there, left atrium and the left ventricle is called the mitral valve or the mitral bicuspid valve. And the blood flows is usually in a unidirectional flow. Keep in mind, whenever we have a regurgitation or a pathology, that we have backflow of blood, that's where the murmur is being heard. All right, so... All right, perfect. So as a recap, just to indicate the 4 different valves that we have the tricuspid valve, we have the mitral valve, we have the aortic valve, we have the pulmonic valve. So those are the 4 valves that we have. Before I finish this video, we have something called the pectineate muscle, and it's present within the atrium itself, or the atrii. This is the pectineate muscle right there. And we're just kind of putting the whole thing back together. And keep in mind that we have something called the conductive system of the heart, and usually it would arise somewhere around here. It's called the SA node, or the pacemaker of the heart. Then we have the AV bundles coming throughout the right and the left atrium, passing into the auricles, and from there they will be collected at an AV node, and from there they will descend along a bundle, a Purkinje. Then eventually they will subdivide into right and left bundle branches, and from the bundle branches they will go into the cardiac muscle. Please keep in mind that we have something called the autonomic nervous system that controls the heart. Sympathetic would increase the heart rate, the parasympathetic will decrease the heart rate. And again, this is the pulmonic valve that will be pumping blood into the pulmonary circulation, while the left ventricle will pump into the aortic valve into the systemic circulation, and this will go throughout the whole different body organs and systems. Hopefully that you guys would love this video, and have a great day.